nutrition is essential for our health and our well-being, but we don't have little dials on our heads. And we go a lot by how we feel. And in my 23 years of working here, I see a lot of people who just don't feel well, but they don't know why they don't feel well. And there's a tendency in our current medical climate to basically just treat symptoms. If you got a headache, here's your pill for the pain. And if you've got problems with your joints, here's an anti-inflammatory. If you're depressed, here's an antidepressant. And so Dr. Riordan, as a psychiatrist, was concerned that, well, wait a minute, that's one way to deal with it, that's dealing with the symptoms, but what are the real underlying causes of why people are not feeling well? What are the real underlying causes of why certain diseases run through certain families? Why do people not sleep well? Why do they run out of energy? There's a lot of fatigue. When you start talking to people, people are tired. And so his thinking was, you know, you can treat the symptom, or you can look for the underlying cause. Well, that resonated with me because I grew up working in my dad's gas station. And if someone came in and they said, our oil light is on, let's say you came to my gas station and my dad's gas station and your oil light was on, and I said, here's a piece of black tape, just cover that up and, you know, call me when the engine quits, okay? You wouldn't think I was a very good mechanic, would you? You might not even come back to the station. But yet, in our culture, our medical culture nowadays, that's the tendency, is to treat the symptoms and just hope for the best. And I think very often the body does have the amazing ability to correct itself, and people do get well, and they don't necessarily fall over. But to me, it's not a good way to take care of our biology. We are biological creatures. And we are made up of cells, and we need to take care of those cells, and we do that by feeding them. So what's different about our approach is that we are looking at what fuels the biology of cells, namely nutrition. And where the clinic, in a way, became unique, and I have to tell you that Dr. Riordan started as a partnership with Olive W. Garvey. Mrs. Garvey was a very innovative person herself, and she had read a book called Nutrition and Mental Health, and there were members of her family that were having problems, and she went to her doctor and said, can we measure their nutrient levels? And the doctor said, we don't do that. You know, we're doctors. We don't touch that nutrition stuff almost. And so she really thought what needed to be done, though, was to check their nutrient levels, and so she happened to run into Dr. Riordan, and that was how the lab was formed. And the very first director of the Riordan Clinic lab is sitting right over there, Dr. Charlie Hinshaw. And the idea was use the lab to actually assess the nutrient reserves of the body to see if something was out of balance, something was missing. It's a very logical thing. Mrs. Garvey thought, duh, this is what I do. If the plants aren't growing right, I go get the soil checked. And we get the right kind of fertilizers to make the soil balance, and then the plants grow better. Same thing with human beings. If things aren't working well, let's check and see what might be missing and see if we can fill that in with natural substances that help the body heal itself. So this is getting to the point of my lecture here. Do illnesses just happen? Is it just bad luck? Because if you really, I mean, most of the doctors, not to put any doctors on the spot, but the next time you see them and they make their diagnosis, ask them, why did I get this diagnosis, doctor? They'll say, well, I don't know. Most of the times, it's, you just bad luck, you know, wrong genes. You chose the wrong parents. Or are there reasons why these illnesses very often occur? Now, one of the things I'm going to get into is family patterns, because that's, to me, one of the compelling reasons to think about having your nutrient levels checked, is because very often we do see patterns in families, whether it's macular degeneration or heart disease or cancer patterns. There can be other reasons. People that live in families, it's not just your genetics, it's your epigenetics. It's the behavioral choices that go in those families. Very often certain families eat a lot of, they're a sweet eating family, or they're a very high stress family, or they don't hardly ever sleep at all. So there are behavioral patterns that also occur in families. So just using as the example though heart disease, you know, if you have a parent, an aunt or an uncle or a grandparent with heart disease, what is it about them that maybe you might be inheriting? Are you inheriting a habit like smoking? Are you inheriting weight issues? Are they the hotheads, the type A personalities? Do you guys all know how the type A personality was determined? Two cardiologists, I think it was Friedman and someone, they looked at their waiting room, and they had all heart disease patients, and the front edges of the chairs were all warrant because these people were sitting on the edge of the chair. You know, they're raring to go. So was it the personalities, the eating habits, or the genes that set them up for their heart disease? Let's take another one, macular degeneration. Very often you hear about that running in families. Is it just a genetic problem? If it is genetic, does that mean that there's nothing you can do? You're predestined just by being a relative to have that same problem? Alzheimer's, arthritis, diabetes, cancer. These are all things that we're hearing more and more about in our day and age. Part of it is that people are living longer, but part of it is we're living in a world, very fast-paced world. People are not necessarily eating as well. We hear discussions of how the soil isn't what it used to be, foods aren't what they used to be. Toxic factors in the environment are more so than they ever used to be. People are not exercising as much, maybe not getting as much sunshine. Sleep is not as good. People watch TV too late, or they're working on their computers late at night. They're not sleeping as well. We hear about chronic skin conditions. Obviously, the obesity epidemic is becoming a bigger and bigger problem. There's many things that we hear about these diseases, and so the question is, are we helpless victims of whatever our family patterns are or whatever we hear is going on in our culture? And I'm going to say no. I'm going to say that many of these diseases come about as an expression of environmental factors interacting with our genes. Now granted, if you have genetic features, you may have, like for example, the BRCA2 gene for women in terms of breast cancer. That does statistically increase your risk. But even there, it may be a factor of what you're eating, how well you're exercising, what your weight is, what your hormonal balance is. All these can be factors as well. So these various environmental triggers such as smoking, poor diet, toxicity, obesity, sedentary lifestyle, stress, sleep disorder, all these things, injuries if you've been chronically injured for some reason, or if you've had a potential or a greater propensity for injury, these can be environmental triggers. But the big one that we do have some control over, though most of us don't know it, is nutritional deficiencies or nutrient deficiencies. We don't think we do. We just say, well, doctor, I'm eating a balanced diet, or doctor, I'm taking a multivitamin. The question is it enough for your biochemical needs? And that's what we find is the thing that we have to offer here at the Riordan Clinic, is that we can help people assess their own nutritional status. So that's the reason that I'm going to ask this question, why should we measure key nutrient groups? Well, if we look at the research, people who have macular degeneration, for one thing, they might have low lutein. They could also have low zinc. You know, actually some of the eye doctors in town and around the country, they're the ones that are really getting on the bandwagon as far as using nutrients to prevent the manifestation of these chronic diseases. Heart disease, low CoQ10, high CRP, these are pretty well established cofactors. You know, you can look at some of the other ones like if you are low in vitamin D, you're at higher risk for heart disease. So these are not the only ones, but these are a couple of nutrients that do portend or increase your risk of manifesting congestive heart failure or vascular disease of your heart. We know that people that are pre-diabetic tend to be low in magnesium, and they tend to consume too much sugar. Or they may have low chromium levels, for instance. Cancer patients aren't getting enough of the colorful phytonutrients and antioxidants. That's why the American Cancer Society says, eat your fruits and vegetables. Osteoporosis, we know it's related to low vitamin D and inadequate calcium absorption. If you are low in tryptophan, you're going to be a little bit more prone to endogenous depression. Carpal tunnel syndrome is associated with low vitamin B6, and if you have a high cholesterol and a low HDL, that can be associated with low vitamin B3 levels. So that leads us, hopefully what I'm doing is painting a picture that helps you see that there is something you can do to check your health. You can do what we call personal epigenetics. Look at the effect of your choices to this point in your life as a means of helping you change the course of how a disease could manifest in you or within your loved ones. And that you do this by simply checking key nutrient levels and seeing whether or not the disease pattern or the condition that you're concerned about is modifiable by virtue of correcting a deficiency in a certain area of your nutrition. So hopefully there's a famous saying, you know, to avert the problem before it occurs. I think they call it preventive medicine, don't they? Be proactive in your own health care. So, you know, we worry about this big thing called health care reform and how are we going to do it and how are we going to pay for it. I don't know. People say, what do you think about health care reform? I think it's all a big mess is what I think. And it's so huge because we have people who are not taking care of themselves and the system is trying to rescue them, and it's very expensive once you get sick. So my motto is, rather than waiting for some kind of mega system to suddenly emerge, and I don't know if any system is going to emerge the way politics are looking these days. They say, by the way, did you remember that earthquake that occurred in Washington, D.C. and Virginia, that whole area? That really wasn't an earthquake. That was our forefathers turning over in their graves. So anyway, we want to get you interested in measuring as a way of helping you understand what you can do for yourself. It's an individualized nutritional approach that takes the controversy out of diet and supplements, helps you personalize what you need to do, and it prevents you from literally running out of gas. And this is we've had these lectures before, and my famous question that I ask the audience is, how many of you have ran out of gas in the last year? Has anyone you have? A couple of you have, okay. So normally not too many people do. Why not? Why don't more people, why doesn't everyone run out of gas? You've got a fuel gauge. And when it's getting low, you take action. You actually go to the gas station or you do something to prevent you from running out of gas. And so that's what we're doing with this particular Check Your Health program. We're helping you gain the ability to assess the adequacy of key nutrients. And so if your gas gauge is on fuel, and we actually do, when we send out the reports, they are actually coded along a spectrum of blue, green, yellow, and that one should be orange. I guess it does appear orange on here, and red. So this person's got good reserves of whatever nutrient is we're assessing there. And when it's in the green, it's plenty adequate. You're fine. If it's yellow, you need to be starting to think about that. Where can I get more of this in my diet, for instance? Or should I check my multivitamin and make sure it's there? But if you're in the orange area, you're starting to, you're getting in risk of running low. You need to do some planning. And if you're red, you're frankly in danger. And you really need to take action and either take a supplement or really work on the dietary source to get that supplement up. So here's an example of a selenium level that we measure selenium as part of many of our panels. And this person's level is in the low end of yellow. They're not out of gas, but they might want to think about eating more nuts or something like that that's a good source of selenium. or they might want to make sure their multivitamin has selenium in it, and it's something they may need to take a careful look at if they've got a tendency for macular degeneration or if they've got a tendency for cancer. Selenium is a very good thing to have amounts of. So this is where the panels come in. Most people, it's usually not just one nutrient that is the issue, but if you've got a condition such as breast panel, or if you've got breast cancer in your family history, this would be the panel that we would run on you. These are nutrient levels that have been shown to be associated with if they're low, with a higher risk of cancers in general. Some of these are specifically related to breast cancer. So by assessing these levels, you get a pretty good idea of what the constellation is of these symptoms. And if some of the stars are kind of weak in that constellation, that's action that you can take to reduce your risk for future problems. So you can use this idea of organ risk to pick your panel. A lot of people say, well, which panel should I do? If you've got a family history of certain problems, that would be one way of picking the health panel that would be of greatest help for you. Or if you've got a very poor diet, you could really just about use any panel or do the mega panel, which looks at all of the various nutrients that we can measure here. So at this point, I think what we'll do, I've got a series of questions here. Before I get to them, I've introduced Dr. Hinshaw. He was the very first director of our lab, and he's come back again. He's he liked it so much the first time, he's back again. And he's doing a tremendous service to help us with our laboratory. And Dr. Jennifer Kaumeyer is a naturopathic physician that has been here. How long have you been here now, Jennifer? About
7 months.
7 months, okay. And I don't know how many of you know about naturopathic doctors, but they do the full medical school curriculum, but they've gotten smart. They put in all the nutritional things that relate to the diseases. They put in the herbal factors, dietary factors, hormonal factors, all the things that you can naturally do to correct imbalances within the body. So it's a very safe, logical approach to working with chronic illness. And so what I want to do is kind of open the floor up for questions that you might have. If we don't I've got some questions here that we can go over, but let's just see at this point what kind of questions you might have about what we do here, or specific nutrients or specific health panels, and see if we can answer your questions. And my job is we're being videoed, and so I'll repeat the question for the sake of, people are watching this on the internet. So any questions or comments? Yes, ma'am.
Excuse me. Regarding treatment of chronic fatigue, let's see. Well, have you had much success with carnitine in treating that? I read a little bit about it, and I'm pretty much a success story with venison, but I'm drinking lots of water forever and ever. So that's, alcoholics never run out of their liquor, but I never. But anyway, I wondered, I guess my two questions, one of them is, have you had success with carnitine, and do you ever see people wean off of venison?
Okay, so the question, just for the sake of the tape, in the case of chronic fatigue, can carnitine be helpful in that? And what was the second question?
Well, when you usually see someone have success with venison, are they on it for life?
Oh, and then using guaifenesin as a specific treatment for chronic fatigue and fibromyalgia. Yeah, and
Specifically chronic fatigue.
Yeah, I think let me direct the first question to Dr. Kaumeyer. You want to talk about carnitine?
About L-carnitine?
Yeah, how does L-carnitine work, and why might it be a logical thing for chronic fatigue?
L-carnitine really helps with fatty acid metabolism, so helping fat get into the cell, which can help with energy. In a brief explanation, do you have any more explanation with that? But when you look at one nutrient and one individual, the way I treat chronic fatigue or whatever a patient comes in, L-carnitine might be a tool in the toolbox, but it really depends on that individual person, what's going on with them. I've seen L-carnitine help chronic fatigue patients, but sometimes it doesn't help chronic fatigue, people with chronic fatigue, because not every person who has the symptoms that we're putting into this category of chronic fatigue are the same. Everyone is still so different that I can't say it would help everyone, but I've seen a lot of, not only chronic fatigue, but thyroid problems, other hormonal issues too, because chronic fatigue is a combination of deficiencies and hormone problems. But I don't know if that answers your question at all. But
it's kind of goes along with my second famous question that I usually ask the audience. And what is the most important nutrient, no matter which disease you're talking about?
Oh, I know.
The one that you need.
It's the one you're
Right.
lowest in. Yeah, so
Right.
if you were
The
really
limiting
low in
factor.
carnitine, and we had another individual that had chronic fatigue and they were not low in carnitine, which one do you think would most likely get them benefit from it?
And also L-carnitine, you know, it all depends on the dose. It all depends. L-carnitine can also inhibit the thyroid too. So you really gotta, you really have to look at it on an individual basis. You know, I wouldn't say to everyone who has chronic fatigue, I just don't like people self-treating that way because, you know, because it can inhibit the thyroid. So if someone has a really hypothyroid, giving a whole lot of L-carnitine, I use L-carnitine for someone who has a lot, who is hyperthyroid. It can help block the, I think it's the T3, yeah, tyrosine or something like that. I can't remember exactly, but it can be helpful in people with overactive thyroid. So, did I answer that?
Yeah, and then to answer your second part of your question, Dr. Paul St. Amand was a doctor who discovered that guaifenesin, which is the medicine that's in a lot of cough medicines, Robitussin and whatnot, is beneficial in terms of helping people balance out their mitochondria. They do get better mitochondrial function as a result of it. And so it can be useful, though like you said, you have to drink a lot of water with it. And so it's more of a safe pharmacological approach to chronic fatigue and fibromyalgia.
And another, you know, point I'll make is that, you know, just because you could be eating fruits and vegetables all day long and taking really good vitamins, and sometimes people can still be deficient because of other reasons, right? So medications deplete nutrients, you know, your reflux meds are a big one that deplete lots of nutrients. Birth control pills is a biggie that everyone's on that depletes lots of nutrients. So that needs to be addressed too, toxicities, but I think I kind of went off track there, but.
Oh, that's fine.
I think it's important to kind of clean up the terrain at the onset of this and find out if you have excess mercury or deficiency of something else and set the stage then for improvement. Second comment, well, that gets back to a second comment, which you've both alluded to, but this business of illness and disease and nutrition is multifactorial, and it's kind of like the ankle bone's connected to the leg bone and the leg bone to the hip bone and so forth. They all interplay. So you have to consider that when you're talking to the patient or ordering lab tests. Finally, hyperbaric oxygen has been of help recently in people with chronic fatigue syndrome.
The Check Your Health program that we're talking about today also is we set it up to be for people who may not be struggling with a severe illness, but who notice that there's a pattern of illness in their family, or maybe they have the early warning signals of early stages of an illness. It's not really, we're not at this stage using it to treat illness, we're using it to help people prevent illness. Now you can, and what does happen is that most people we find have something already going. You know, there's very few people walking around that can say I have no symptoms whatsoever. And so for those people who have something going and they want to kind of get a baseline data, laboratory data, nutritional data, I think it's a good thing, but that's where working with myself or Dr. Kaumeyer to kind of help you sort through may be necessary. But if you're in relatively good health, just checking your nutrient levels and then using that as a guide to diet and supplementation may be enough to change the direction of any emerging illness that you're dealing with. Yes, ma'am.
You touched on hormones and that type of thing. Do you do like the full panel of hormone testing to check all of the different hormone levels?
Yeah, the question, just let me repeat the question. Do we do a full panel of hormone tests as well as the nutrient tests?
Yeah, yes, we do. We test most any hormone we can test here, but for we don't have. Do we do hormonal? None of the. Only DHEA is on a couple of the panels here, but.
Right. The hormonal interventions that we have to do are prescribed, and so you have to have a doctor-patient relationship. And so, again, Check Your Health was originally envisioned by Dr. Riordan as a way for the community. He wanted to give back to the community, and so he said, let's go ahead and make these tests. We'll have a lot of people come in, do tests. We'll batch them. It'll lower the cost. We'll provide them at a discounted price so that just the average person who is not doing too bad, that wants to assess their nutrient levels, can come in and do that. Now, if you want to do hormonal testing, we definitely do it because we think it's an important part of especially complicated illnesses or the aging process, kind of as an anti-aging approach. But we're not doing it as part of the Check Your Health per se.
And if you guys, say you meet with me after, because you sign up, and we, basically in that 30 minutes, I'll get your, chief complaints, what's going on with you, look at your results, kind of give you some advice on what to do. But if, based on what you tell me, I can then at that point, I can order a hormone panel for you if you want to do that, or I will guide you where I think you should go. Basically, I'll give you my opinion on what needs to be run, what needs to be checked, and that's what I try to do.
If you find deficiencies there, do you use bioidentical hormones?
You're talking female hormones. We can, the way I was trained is always try to balance hormones through natural means first, which most of the time we can do. Depending on the woman, if it's interfering with her life and she can't function, I go straight to bioidenticals. But you can manipulate your hormones if you're having other female issues naturally with certain herbs, nutrients, lifestyle factors that without even getting on hormones, which is
and very often toxicity.
A good thing, because hormones deplete nutrients.
Toxicity plays into this too, and if you have toxic factors at work, that can interfere with normal hormonal functioning. Mercury, for instance, can interfere with thyroid functioning, and so sometimes by doing various detox protocols, you don't have to get right into hormone levels.
And another big one is bowel function, constipation can really mess your hormones up, and a lot of times just getting that regulated in a woman or man can start helping your hormones function better. So, yeah.
Dr. Kaumeyer failed to mention that she's going to be talking on this subject. October 22nd?
I will be talking on female hormones September 22nd at Green Acres.
For 1 hour. So if you really want to dose on hormones,
and then
about
next
a week
month
from
I'm
now.
doing a talk here on that as well. It'll be geared a little different.
Where is Green Acres?
21st and Rock. It's a health food store. And what's the Bradley Fair. I want to keep saying Briar Creek, but that's Raleigh, North Carolina, where I used to live.
Any other?
By Yaya.
There you go. Source of bad food from a health standpoint. Tastes great.
Any other questions? Yes.
What about chronic leukopenia?
What about chronic leukopenia? What are the causes of chronic leukopenia and what can you do for it?
With this testing, I already know I have it. Would this testing make it possible to change it, or is it something that's inherent?
For the audience listening in or viewing, leukopenia is low white count, and there can be many different causes. Would either one of you want to take that? It's where the bone marrow is not working properly. My understanding is very often there's been a viral infection that can affect it. It could also be a toxicity factor, or maybe you've been on some antibiotic or strong medicine in the past, which has altered the functioning of the bone marrow. And the question is, would this testing be of help? It might. And again, one of the things I had to change in my thinking when I started working here is that, and you would think this would be pretty obvious to most people, but doctors don't heal patients. The body heals itself. And what we do, especially here, is try to assess to see what might be missing from the body's team of nutrients that could be interfering with the healing process. So when you say, is there something that fixes leukopenia, probably the question is there something that you're missing that might help your body heal the cause of that leukopenia? And for that question, the testing could be helpful. There could be, maybe you need more vitamin C, or maybe your vitamin D levels are low. I don't know specifically which panel to point you to unless Dr. Hinshaw or Dr. Kaumeyer has a comment on that as to which panel would be best. But I think it's one of those things that you certainly could do to possibly discover something that your body is missing.
Well, I think the nutrition panel, the new patient panel, would be good. And I can't find it in my notes right now, but there is a specific nutrient that is sometimes associated with neutropenia. And if you'll catch me afterwards, I'll find it in my notes and tell you. But I think the right approach is to be more comprehensive than trying to shoot it with one shot.
The nutrition panel, which is in here, and I guess you all have this at your place, basically is all of the nutrient levels that we measure here. And we tend to do that as part of our new patient evaluations. We also do a cytotoxic test, so we're looking for the right name for it. But like the bionutritional panel is what we do with new patients because we add that food sensitivity test. But in general, the nutrition panel is kind of a foundational approach to dealing with any chronic illness because we're looking for where the gaps are in your nutrient team and helping you fill that in, hoping that your body will then rise to the occasion to deal with whatever the chronic illness or constellation of illnesses are in that individual. So you can do that for yourself. You can do that testing and use that as a basis to scientifically begin rebuilding your nutrient team rather than just, you walk into a health food store and there's just bottles of supplements everywhere, and which one do you take? And certainly the clerk or whoever will have your neighbor, everyone nowadays is a nutritionist, by the way, it seems like to me. So everyone has an opinion about what you should try, but the beauty of the testing here is it is an actual measurement of your chemistry to see what your body is missing, and so it's got a higher probability of doing some good.
And also, when you're picking supplements, there's different forms of vitamins as well. So, you have to be cautious of that. Some are absorbable, some are not. Some you don't want to take together. So there is, a possibility that you could be taking things wrong or the wrong form of a vitamin, especially the ones at most drugstores are very inexpensive because they're very cheap forms of the vitamin, and most of them aren't really absorbed by the body. So it really does make expensive urine. So
those are what's called food-grade vitamins, and they can be of some value, but if you can get the pharmaceutical-grade vitamins, you're going to get a better absorption and better utilization more often than not. Yeah, go ahead. No, that's where we're offering, to have people who do the testing come in to see Dr. Kaumeyer to kind of help you decide on which doses might be most beneficial for you. Basically, when Dr. Riordan came up with this program, the reason he didn't want to put the doses in is because then we're prescribing. And really, a doctor shouldn't prescribe without having the doctor-patient relationship. So, but there's a lot of people out there now that are more nutrition conscious and more nutrient savvy and are using their own supplements. And so this is a way for them to actually assess if what they're taking is giving them reasonably good levels or if they're missing certain things. And you can always go and most of the supplements that you can buy from health food stores or from us have a suggested dose on them. So you can always follow the suggested dose on the bottle, and those are set up to be very safe dosage ranges. We will oftentimes here, though, use what's called an orthomolecular dose. We'll use a dose that research has shown to be more effective, but it may be higher than what you typically might take, but you're doing it under our supervision.
And if you do meet with me and you do a panel, I'll make sure I tell Sarah to tell everyone, but bring your supplements you're taking with you so I can kind of see what you're taking, the actual bottle of everything. Very helpful. Not only for nutrients, but other additives and other things that could be in those.
Yes, sir.
Do nutrient levels affect blood pressure?
Absolutely.
Yeah, go ahead. You guys can answer that.
Yes. There are a number of the vitamins, particularly in the B vitamin range, that are associated with heart function. And then there's some amino acids. There's CoQ10, which has already been mentioned. They're all interconnected. Magnesium, calcium, potassium, the whole thing.
Yeah, the way I am starting to think about it is that we are a biological creature. Nutrition does have a bearing on how we feel. What confounds conventional medicine is that we're so used to thinking pharmacologically, like, okay, you have high blood pressure, here's a high blood pressure medicine. The way you need to think is, what's unique about my biochemistry that would require me to take this or that nutrient to help balance out my vascular function? And that's what we call biochemical individuality. And in other words, you could have 10 people with high blood pressure, and maybe they each may have a little bit different need in order to get their blood pressure regulation balanced. And so so in a sense, what we do here is it's a kind of detective work, in the sense that we're trying to detect what it is that each person needs, and we depend heavily upon the lab to help us do that. Otherwise, we can listen to people's symptoms, but until we actually do the footwork of going into your inner realms, looking at your biochemical levels, we won't know what you as an individual would need. And that was the realization that Dr. Riordan came to. He first started out just dealing mostly with psych patients and doing this same sort of thing, testing people who had schizophrenia or depression, and finding out that, oh my gosh, you could have 5 schizophrenics and 5 different configurations of nutrient deficiencies or imbalances. But when he would correct those, they would get better. Oh, by the way, doctor, my knee pain is gone, or my migraines are better. And so then he began to realize that when you start to correct the biochemistry, it doesn't just correct that one condition, it starts to help the whole body. So nutritional medicine is by nature a holistic approach to healthcare. So that's a good question. Any other questions or comments?
Regarding evening primrose oil, do you advocate taking that twice a day? I mean, some medications or nutrients like calcium, you should take it twice a day. Do you recommend evening primrose oil that it be BID versus?
Well, let me just repeat that for the camera. So should evening primrose oil be taken once a day or twice a day? What's the best way to take oils? What would you say, Jen?
I would say, I always tell people, if you can break it up, break it up. But a lot of people who can't get the second dose in or don't get it, getting it all in at one time is better than breaking it up. But, things like that and another one, fish oil, I usually, for the most part, don't see a problem with doing 1 a day dosing. It just depends on the situation, really. It depends, again. But
One more comment on that. You want to take fat-soluble vitamins with fatty meals. So don't cook up a big vegetarian dinner and then take your oil because it won't absorb. Not as well anyway. Second comment, on the you were talking about evening primrose oil, which is an omega-6. And one of the initial steps in breaking that down results in inflammatory type, you know all about that, okay. I think it's much better. A lot of Americans now have a ratio of omega-6 to omega-3s of about 20 to 1. It should be closer to 1 to 1. We get an abundance of the omega-6s through our diet, but we don't get enough omega-3s.
Yeah,
Just had
Dr.
a
Ryan.
question about like bowel function, absorption. You guys kind of talked about that. What's all involved with absorbing the food or keeping the meat from absorbing different nutrients?
Okay, so the question is, malabsorption is a common cause of nutrient deficiency, and it's probably one of the prime reasons why people who are eating well and taking supplements may not still have a good level of a certain thing. And so the question is, what are the factors that cause malabsorption?
Well, there's a lot of factors that cause malabsorption. I could sit here all day and talk about that and describe absorption, and inflammation, stress can cause malabsorption, parasites, yeast, medications, all sorts of things can cause malabsorption, where the nutrients aren't being digested, and digestion is breaking down in the stomach and small intestines, and absorption is actually going through the cells to get into the bloodstream. There's a lot that can go wrong there. So that's a huge factor when it comes to nutrient levels. That's one of the reasons why IV therapy and IM injections can be helpful in the beginning to help boost levels, especially B12, because the B12 is pretty common. I see that all the time, especially in the elderly. I don't know if I'm answering your question or what you want me to say.
So the aging process alone can slow down absorption. I think the biggest thing, one of the bigger things that I'm appreciating as time goes on is that so many people are on acid blockers these days. The proton pump, Prevacid, Nexium, acid blockers, people go on that, and the package insert clearly says, you know, only for about 8 weeks is about the maximum you should be on it, but people will then go off it. And again, if you haven't corrected the underlying problem, they're going to have their symptoms come back, so naturally they'll stay on the medicine to control the symptom, because no one likes to have an acid reflux problem. But when you shut off acid production in the stomach, your B12 cannot be properly absorbed. You can't break down your amino acids properly, so your proteins down to amino acids. Calcium is not absorbed as well. They're saying there's an epidemic of osteoporosis. It's here actually, but it's probably just going to get worse because people are not absorbing calcium and minerals like they should. So that's just one medicine, but then you start looking at all the many types of medicines that people take, especially as they get elderly. People go to their doctors a lot more when they're elderly, and doctors will tend to give a prescription when you go in. And so I saw a lot of patients in the nursing home that were on 10, 12 medicines, and so that polypharmacy just sets them up for an already worsened tendency for malabsorption. So those are all factors that could.
And I was just talking with I don't prescribe PPIs or proton pump inhibitors, which are acid reflux blocker medications, Nexium, what are them, Acifex, Prevacid. But according to this doctor, they said that the pharmaceutical companies just sent out a notification to all the doctors who prescribe them to say, start giving your patients magnesium. So that's a huge one that they just got a notification about. But then you start taking magnesium and you're on an acid blocker, well, you're still not going to absorb what you're taking orally, you know, because people, you know, so anyway, I just, you know, you can take your calcium and magnesium, but you're still going to have a hard time absorbing them if you're constantly on acid blockers. So
one of the tests that we have, it's not listed in this, I don't think, but I wanted to mention that we do cytotoxic food sensitivity testing here. And most people don't know what that test is, but it's a very simple test, actually. It's where when people come in and they're fasting, We take their fasting blood and we spin it down and we separate out the red cells from the white cells. Then we take your white cells and mix your white cells with 90 different foods separately to find out, and let that incubate together for several hours. And then we look under the microscope at your white cells. What did that food do to your white cells? If it didn't do anything, that's okay. That's a zero. That's a non-reaction. But if it starts to have a negative effect, some toxic effect on your white cells, we can quantify that either as a 1, which is mild, 2 is moderate, 3 is severe, and 4 is toxic, full-blown toxicity. And that can be very helpful with many common symptoms such as acid reflux. People very often, if they're eating sensitive foods, they can cause acid reflux. It can have a bearing on arthritis because your joints can hurt when you eat these inflammatory-prone foods. They can cause depression. They can cause fatigue. And so when you start eliminating those foods from your diet for a while, let your system rest, let the inflammation heal, then many common symptoms will just get better. People will lose some weight if they have excess weight. Their swelling will go down. Their moods will improve. So a lot of very positive things can happen by getting these idiopathic foods out of your diet. When I say idiopathic, what I mean is they may just be true for you. Like one of my worst ones is onions. And a lot of people say, "Doctor, that's my favorite food." Well, that's great. You know, that's good for you, but onions doesn't like me. And so, so I just have to watch out for that personally. But so you find out a kind of personalized map as to which foods are going to be the best for you and which foods you need to watch out for. So that's another thing you can do. I think am I correct, Jerry? Are we offering that for people that are?
The sinus toxic food sensitivity test is one that we did add this year.
That's this year, yeah. Haven't had it in prior years. So.
It's also in that basic cytotoxic. It's also in the inflammation panel.
In the inflammation panel, it includes 24 food. The most common, 24 most common foods are in the inflammation panel, and that can be very helpful for people who are dealing with inflammation. Yes, sir.
Do you have a way, or can you talk a little bit about your success when people correct their nutritional problems and everything here at the clinic? What is your record of success?
Success. Okay, the question is, what kind of a record of success do we have using this approach? Well, I'm in my trying to think, 32nd or 33rd year of practicing medicine, and I did about 11 years before I came here. So that's whatever that is. That's 23 years I've been here. And I tend to see, I would say, if people are able to utilize the information that we find in the testing, I see about a 70 to 75% success rate. I won't say that everyone is 100% successful for the simple reason that the more I'm here, the more I realize there are many different factors that enter into illness. There are family stresses, sleep issues, a lot of different things. And so we try to cover as much as we can holistically. But you know, one of the best things about the Riordan Clinic is that we refer to our patients as co-learners. And I think the reason Dr. Riordan came up with that term is very early on he realized, there's a famous quote, I can't remember who the doctor is, but he said, you know, treating a disease is easy. Finding what makes people healthy is hard. And so we invite people to be co-learners because we can't make people healthy. You can't legislate health. You can't force health. People have to really they have to strive for it and work at it. And so we're here, though, in a kind of mentoring, coaching role. We bring to bear the resources of the laboratory. We try to have the very best supplements that we can have. You know, we have a whole folder up there of independent laboratory testing to make sure they're pure and good quality. But even then, there are many variables that go into creating health. But overall, I would say our success rate is phenomenal. I couldn't be here 23 years if I didn't have people coming back to me saying, "Thank you, doctor, for helping me find my way to better health with less medicine." That was probably the big thing, is that we do this without relying hardly at all on medication. And so that's the real strong point of this program, because a lot of people are getting a little bit concerned about the long-term side effects of medicines, the costs, and so this is a non-pharmacological approach to restoring health. So given that fact, I think we do exceptionally well. I think we're about out of time. Any one last questions or comments? We appreciate you coming today, and hopefully this has been helpful to you. And what we're going to do is the three of us are going to stick around. We've got a table back there for Dr. Hinshaw, a table for Dr. Kaumeyer, and I don't know, I guess I'm going to be up here.
Yeah, that table right there.
Right over here. And you're welcome to kind of consult with us kind of one-on-one. It's, if you want to have some personal questions about which panel you would like to do or what you are interested in, we'd be happy to stick around and answer your questions.